Well, hello, my name is Cynthia Rowland, and I am one of the Ageless Sisters. My other Ageless sister, Jackie Silver, is off in Philadelphia today, being brilliant on Philadelphia TV. But I am so delighted that I have as my guest today Dr. Sherri Tenpenny. She is from Ohio, and she has been called some of the nicest names for a physician because I have heard in the last week the Mother Teresa of modern medicine, and somebody said she probably has angel DNA. So welcome, Sherri.
Thank you so much. How kind of you. Thank you very much.
Well, it's so nice for you to take the time out of your busy schedule to spend a few minutes with me today. I know that earlier today you were talking about breast health, mammograms, and other things. And can you just kind of give me a little thumbnail about what you talked today about?
What we talked about?
Yeah.
Well, I was one of the speakers at the Health Freedom Expo here in Long Beach, and I was talking about the fact that we need to get familiar with the whole concept of breast health, and that we really need to make friends with our breasts.
Yes, we should.
We really should, and we should get to know them, and we need to look at them as an organ that requires attention, requires nourishment, that needs to look at the energetic part of it, need to look at detoxification, just like you would the whole rest of your body. I've had a lot of women over the years tell me that they never really occurred to them that their breasts were something they could do to be actively keeping them healthy. So we talked a lot today about the different types of supplements that you could do. I showed women some lymphatic exercises that they could easily do every single morning when they get out of the shower. We talked about the myth of the normal mammogram and the fact that breast cancer starts from one abnormal cell. At least that's one of the basic theories. And then it goes to 2 cells and to 4 cells. And if you could think about that first abnormal cell as sitting on the ocean floor, and as it develops, it grows and grows and grows. And by the time it gets to the surface of the ocean, where it can be first seen by a mammogram, that period of time from the ocean floor to the surface in the fastest growing cancers is 7 to 9 years. So mammograms just detect problems in the breast. They're not preventive. I think a lot of women think, I need to go get my mammogram like it's going to keep them from getting cancer. All it's doing is looking to see if you have it yet. And what I tell a lot of women is that if you get bad news, if you get a diagnosis of cancer, the very first thing you need to do is to sit down and take a deep breath. That's been going on for a very long time. It is not a sense of urgency. It's not a 5-alarm fire. You're not bleeding to death. You have time to talk about what you want to do. Do you want to follow a completely conventional medicine course? Do you want to do completely alternative medicine? Do you want to do a combination of the two? Go out and gather all this information, be on a mission to find out what all of your options are. I've had women that have gone to 3 and 4 different doctors until they found the one they thought they trusted the best. Then take all that information and then sit quietly with it, because women in their intuitive sense, they need to listen inside what sounds like the right thing for you to do. And then once you set your course of action, turn out the rest of the noise. And don't have a conversation with anybody, your sister, your brother, your mother, your aunt, your best friend, unless they're going to support your decision.
And you know, you said something so profound, is that so many women who get news that there's something off, they immediately, I'm just going to speak for my girlfriend. She was diagnosed with breast cancer. And instead of her going to have a second opinion or a third opinion, 2 days later she was having chemotherapy. And it has wrecked her life. And she looks like she has been in a concentration. Yes, and in a concentration camp because. And I don't think anything has been solved yet.
What I usually see is like people when they go get a mammogram, if there's something abnormal, I visualize them as all of a sudden being sat on the fast conveyor belt. And they go from there to the surgical suite to this, and within 5 days, sometimes they've had a mastectomy.
Oh, I'm afraid that might have happened with my girlfriend. She hasn't said yet that she's had a mastectomy, but I know that in 2 days after having the diagnosis, she was in the hospital.
We treat this like a 5-alarm fire. We treat it like somebody's bleeding to death, like somebody's had a heart attack and you need to resuscitate them. This has been going on for a long time.
So 7 to 9 years.
And the fastest growing cancers, the slowest ones, it can be 12 to 20 years before it can be seen. There's no emergency here. You really do have time to sit down. And I've seen patients, I've had patients in my office in Cleveland where they have decided they don't want to do the conventional route. And they've done detox, they've done vitamins, they've done supplements, they've changed their diet, they've exercised, they've lost weight, they've stopped smoking, they've done all of the things. And within 2 years, it's gone.
That's amazing. What are the supplements that you recommend for someone who has just, well, all of us who have little girls that we want to take care of?
Exactly. There's some very core-based supplements. One is vitamin D, and I want everybody to go out and get your vitamin D test. I want you to find out what your level is for 25-hydroxy vitamin D, because that level should be around 80. And if it's less than 80, even though your doctor may say it's normal at 35, it's not normal. It needs to be around 80. Vitamin D, if we had adequate vitamin D, it's been shown it will decrease the incidence of breast, colon, and prostate cancer by more than 50%. Vitamin D is really core, and once you have an adequate level, what you really need to do is take 2,000 units a day. Turmeric, the yellow spice,
Yes.
300 milligrams a day for healthy breasts, 6 to 900 milligrams a day if you're having some sort of issue. Folic acid is really important, about a milligram of that a day. Calcium D-glucarate is incredibly important. And everybody thinks it's all about the calcium. And they say, oh, I'm already taking calcium for my bones. No, it's really about the glucarate. And the glucarate can really decrease all kinds of estrogens in your body because of a barrier to your breast from estrogens. But the most important key element that's overlooked is iodine. And it's been shown in the medical literature since 1967 that iodine-deficient breasts in the breast duct, those are the areas where cancer starts.
Well, that is great information because everybody should have been writing that down and running off to their favorite vitamin store to purchase this. Do you have a particular line or brand that you would recommend?
Not really through health food stores. We have supplements that we obviously sell on our website through our company. They can go to drtenpenny.com and click on the store and go to the vitamins there. And I'm really picky about the vitamins that we sell. I've been to the companies. I've seen the manufacturing practices. I've really studied these. Out there's 5,500 supplement companies. I know there are good companies, but I can't vouch for the ones that I haven't seen myself.
But you can vouch for the ones that come from you, right?
Yes, I can.
That's so wonderful.
And in fact, we offer a money-back guarantee. If you've taken the vitamins and you can't take them, they upset your stomach, there's a problem, send them back within 30 days and we'll give you your money back.
That's a great thing to have. Saying no to vaccines has been, isn't that a book of yours?
Yeah, that's a book of mine.
Yes. Well, I'm on the same page with you because I have read a lot of the studies from these vaccines and what goes into them, and I think they're very scary serums that they're putting together and highly toxic to our bodies. Would that be something you wanted to talk about?
Well, let me see. A lot of your listeners will probably know me from my vaccine work. I've been involved in the vaccine awareness movement, if you want to call it that, for 11 years. I started in September of 2000. I've written 2 books, Saying No to Vaccines, Foul, Bird Through It's Not What You Think. I've been a contributing author to Vaccine Epidemic, which is a New York Times bestseller, and several other books, and a lot of DVDs, and that's all available on our website. And I started from a place of going, I don't know anything about this. I need to look into it. And since that time, as a board-certified physician, I've spent more than 11,000 hours of my own time researching problems associated with vaccines. Bottom line, just say no.
Just say no.
Just say no.
What about these young mothers who have children who are trying to get them into school and the schools are pressuring them to have their children immunized? What do you think about that?
Parents need to know that they do have a choice. All 50 states offer a medical exemption, which means that if your child is sick or has a reaction, that they can be excused from getting vaccines by the doctor. All states except West Virginia and Mississippi have what's called a religious exemption, which means I don't want that dirty, nasty stuff in my sacred body. I believe in my God-given immune system to keep me well, and you can write an exemption from a religious perspective. There are 19 states that have what's called a philosophical exemption, which means that you've done your homework, you are not afraid of the diseases, you really have more concern about the possible lifetime effects of a vaccine than the short-term transient effects of the infection. You just write a letter to the school and say, I'm not doing it. We have a sample of an exemption letter on the drtenpenny.com website. Click on forms, there's a sample and parents can use that.
That is so good to know because so many women today say to me, I don't want to vaccinate my child, and we have to respect that. I know that this 10 minutes has gone by so quickly, I can't even believe it, but I want to thank you for joining me today.
You're welcome. Thank you
so much.
And
I look forward to having you on our radio show.
All right. Thank you so much.
Thank you.
Okay.